In the past few episodes, we introduced the different causes of migraines. In this episode, we're going to take a closer look at the most common types of migraines in daily life and how to deal with them. These include migraine without aura, migraine with aura, migraine with brainstem aura, hemiplegic migraine, chronic migraine, and more. First, the most common type is migraine without aura, which accounts for about 65% to 80% of cases. It is characterized by recurrent attacks lasting 4 to 72 hours, without aura symptoms, but often accompanied by nausea, vomiting, sensitivity to light, and sensitivity to sound. When it occurs, you'll typically feel a throbbing pain on one side of your head. Everyday activities like walking or climbing stairs can make the pain worse. You may become sensitive to light and noise, but you won't experience visual disturbances like flashing lights. Common triggers include dietary factors, hormonal changes such as menstruation or oral contraceptives, emotional stress like work pressure or exam anxiety, too little or too much sleep, weather changes, bright light, noise, strong smells, as well as hunger and physical exhaustion. If you have more than 4 attacks per month, you may consider preventive medications or lifestyle adjustments such as yoga and maintaining a regular routine. If attacks are infrequent, you can take medications like ibuprofen during an episode, but limit usage to fewer than 10 days per month to avoid medication overuse headaches. The second type is migraine with aura, which accounts for about 15% of cases. Its defining feature is that within 1 hour before or after the headache, you may experience aura symptoms lasting 5 to 60 minutes. Common auras include visual disturbances such as flashing lights, zigzag patterns, blind spots, or temporary vision loss, sensory symptoms like numbness or tingling on the face or one side of the body, and language difficulties such as trouble speaking or finding words. The triggers are generally similar to migraine without aura, but there is often a stronger genetic component. Some people can clearly identify specific foods or situations that trigger their attacks. In terms of treatment, acute treatment is similar to migraine without aura. At the early stage of an attack, you can use triptans or gepants. If attacks occur more than 4 times per month, preventive medications may also be considered. It is also recommended to track dietary triggers. There are also some rarer types, such as migraine with brainstem aura and hemiplegic migraine. Migraine with brainstem aura is more common in young women and is often related to hormonal changes or specific food triggers. Its aura symptoms may include slurred speech, vertigo, tinnitus or hearing loss, unsteady walking, and reduced level of consciousness. This type usually requires prescription medications, so medical consultation is strongly recommended. Hemiplegic migraine includes aura symptoms such as muscle weakness along with visual and language disturbances. It is often linked to genetic factors and may also be triggered by trauma or vascular issues. Triptans should be avoided because they constrict blood vessels. Gepants may be a safer option. Medical imaging is necessary to rule out stroke. The third type is chronic migraine. If you have headaches on 15 or more days per month for at least 3 consecutive months, you may have developed chronic migraine. Common causes include overuse of pain medications, anxiety, depression, sleep disorders, long-term stress, transformation from frequent tension-type headaches, and obesity. Chronic migraine is usually managed with long-term preventive medications and strict control of acute medication use. Behavioral therapy and cognitive behavioral therapy can also be helpful. If 3 or more preventive medications have failed or are not tolerated, botulinum toxin type A injections may be considered. These are typically administered every 3 months after medical evaluation. Studies show that after 3 treatment cycles, about 70% of patients experience a reduction of migraine days by at least half. If improvement is less than 1/3 after 2 cycles, treatment should be discontinued. Another type is vestibular migraine. It is characterized by intense vertigo, usually lasting a few hours. Diagnostic criteria include at least 5 episodes of moderate to severe vertigo lasting 5 minutes to 72 hours. And at least half of the episodes are accompanied by migraine features such as unilateral or throbbing headache, sensitivity to light or sound, or visual aura. Finally, educational videos cannot replace professional diagnosis, and all information is for reference only. If you have more than 3 attacks per month, seek medical care and consider preventive treatment. If you have headaches on more than 15 days per month, you may have chronic migraine. If a single attack lasts more than 3 days without relief, seek medical attention immediately. Migraine treatment is a process that requires continuous adjustment and trial. Preventive treatment does not mean eliminating headaches completely. Reducing attacks by half is already considered effective. We hope this episode helps you better understand migraines.